Why do you volunteer to serve as a member of the reactivated Collaborative Dental Hygiene Practice Advisory Committee?
Well, as a faculty in the dental hygiene program at Normandale Community College, I feel very fortunate that our college was the recipient of a very large and amazing HRSA grant. It was at the time that the Collaborative Dental Hygiene Practice Advisory Committee was being reactivated that I was a graduate student obtaining my master's in community health education, and I was in search of a thesis topic, and so I worked with Dr. Brickle looking at the HRSA grant, and the first goal of the grant is to strengthen the collaborative practice infrastructure. So that really fell nicely with my community health as well as my desire to include oral health. And really that's how I became involved with the advisory committee. They were a big part of my research, but after I graduated, I decided to continue with the advisory committee for a couple reasons. One thing I learned is what an amazing opportunity that Minnesota dental hygienists have in order, they have the ability to get out in those non-traditional dental settings and provide oral health care to individuals who are really in need and lacking access to care. But I also learned that though this model has been around for the past 15 years, it has been really underutilized and in some instances misutilized in the instances where large dental practices were having dentists and dental hygienists form collaborative agreements merely for the purpose of exposing radiographs on new patients without the patient first needing to see the dentist. So really that kind of messed with the data that's out there on collaborative practice, but also it was not addressing the need for oral health care.
What actions or next steps would you like the advisory committee to take?
Well, as an educator, I believe the education piece is key for the successful implementation and integration of the collaborative practice model. But I believe that it's more than just educating dental hygienists. I feel we need to educate all of the dental professionals out there in Minnesota because there really were a lot of misconceptions when it comes to collaborative practice. So we need to educate everyone from dentists who play a major role in the initiation of collaborative agreements to dental therapists and dental hygienists that can really carry out the services in the collaborative agreement. And now hopefully dental assistants will be a part of the collaborative agreement and be able to provide services alongside the dental hygienist. Beyond just the current dental professionals, I also feel that the dental educators are going to play a major role in educating our future generations to get involved in collaborative practice. Specifically, dental hygiene educators could play a large role if we are able to remove the required clinical hours. We will have another workforce pool to choose from or to get out there really and meet the needs of these underserved individuals. And then lastly, we can't forget the organizations in which these services will be carried out, because if we don't involve all of the stakeholders, we're not going to have a successful implementation of this model.